All right. Well, it's one minute past the hour. We're going to get started so that I'm sure each of you have other things to do this afternoon. So thank you for joining us this afternoon. I thought I'd start by introducing myself. My name is Scott Eiselt, physical therapist, as well as the VP of IMC's clinical operations. For those of you that are new to one of our webinars, IMC stands for Integrated Musculoskeletal Care. So we provide care for musculoskeletal problems, which can be back pain, neck pain, nerve issues, muscle injuries, sports injuries, or anything that kind of aches and pains that might ail you. So, and we do so through movement-based solutions. So this typically like exercise-based solutions that can identify the root cause of your problem and then put you on a program or a path to recovery through movement versus say invasive means like in avoiding surgeries or injections or things like that. So many of you have this benefit through your employer in the benefit plan. We'll get a little bit more into what that looks like later briefly, just so if you do have a question about accessing our services that you have the right means to do so. But today, the primary reason we're meeting today is to talk about low back pain, how to prevent it, things we can do to keep it from happening, but then also maybe a few things we can do if we are experiencing it to try to care for it ourselves without needing to escalate or seek care. All right. So without further ado, we'll. Sorry, I got muted there. A brief anatomy lesson, as far as everyone knows how the low back works and functions. And we're going to talk about a few things that can help us prevent low back pain. And then, like I said, some things that we can do if we're currently experiencing stiffness or pain in our lower back. As far as the size and scope of this problem, actually, World Health Organization, which obviously measures things across the entire healthcare spectrum, not just musculoskeletal problems, but they identified musculoskeletal conditions are actually the second largest contributor to disability across the entire globe, with low back being number one on that list. All right, so this is not a problem that's isolated to developed nations or North America or anything like that. This is something that occurs in all humans across the world. All right, it's something that even though there's upwards to 19 to 20,000 articles published annually around the care for low back pain, there still seems to be differences in how we approach low back pain, and so there's a varied approach out there. So we're going to try to give you a little bit more of a standardized look at it. I've been through some of these topics before, so apologies if some of this is repetitive, but I think some of it's important to frame kind of the low back and maybe some facts and myths or misunderstandings, if you will, around our joints. And some of these are generalizable across the entire body, not just the lower back. All right. So a couple things. One is, some may think like, well, low back pain is inevitable based on age. In actuality, it actually affects age groups across all spectrums. Definitely more common as we get into our middle age, say 30s to 50s, if you will, 30s to 60s, and then it actually kind of tapers off a little bit as we get above that. But it's not specific to the aging process itself. All right. A couple things happen as we age. We become often more repetitive, patterned in the things that we do. All right. And a lot of low back pain is actually the cumulative effect. I said joint injuries in general, the cumulative effects of the things that we do to that joint. And sometimes the neglect that we give the joint to for other things like certain movements or positions or things of that nature. All right. So, age is not a direct factor. All right. So you can experience at a younger age and you can experience at an older age. But, to say, well, I'm 50, I should have back pain, or I'm 60, no wonder I have back pain. That's I would urge you not to look at it that way, because there's plenty of 50, 60, 70, 80-year-olds living without back pain. All right. Another thing that comes along with age, time on earth is our joints change the way they look. Okay. So, if you've had an X-ray of your back, or or an MRI, or a family member has, you've probably seen the term degenerative disc disease or degenerative arthritic changes or things like that. And that is a contributing factor to the way the joint works, all right? But it is often, what some would even term it as like gray hair of the spine, right? It's something that occurs as we age, all right? It's a natural part of our joints that change. In some very specific cases, it can be the reason a joint doesn't work right. It can keep a joint from maybe correcting fully if there's a problem that occurs within the joint. But in many circumstances, there are pain-free, fully functioning individuals walking the earth with tons of arthritic and degenerative changes throughout their body. Okay. And so these are often asymptomatic changes, which means they do not cause pain or limitation. They're just the way the joint looks. All right. And one thing that's important is that we need to treat and care for our joints based on how they behave, not how they look. Okay. So how something behaves and when we move it and use it versus how it maybe looks when we're sitting still in an image. Okay. It kind of flows right into imaging. Imaging has a really important place in diagnosis, but it's often best used in somebody who has failed treatment, failed, we'll say conservative care, all right? And they're going to need something it's either their problem is poorly understood, or they're going to need some amount of services beyond conservative care, beyond therapy and things like that, all right? But imaging as a first line of care is actually not recommended by the majority of healthcare kind of bodies around around the globe. And the reason for that is what I referred to earlier, those asymptomatic changes. Okay, so if you have an image done of, you're likely to find many changes in there, but those images don't always tell us what the pain generator is. Okay, so it's very useful if we can't resolve and we're going to need to have a surgery or an injection or things like that, but it doesn't always tell us whether we can heal or not, up front, because people who don't have any pain or any problems can have the same findings. All right, and so there's a very specific use case. Last kind of hot button topic I'll touch on here is inflammation. Inflammation, I've said this before in these webinars, it gets a bad rap, right? Whether it be high inflammatory diets, or I need my anti-inflammatory medicine, and things of that nature. And in some cases, inflammation can be the root cause of a problem, but that's actually less than like 3 to 5% of low back pain is inflammatory based or sourced. Okay. In reality, inflammation is a healthy thing that our body uses to repair from injury. Okay. And so now inflammation that's chronic and ongoing and doesn't resolve, that then becomes an issue. And then sometimes that becomes the reason why we're having a problem. Okay. But it's not watching daytime television or even evening television, you'd think that inflammation is the main reason. Taking anti-inflammatories can make us feel better, but that's often temporary if the root cause is what we'd say is mechanical. Okay, all right. So caution should be used when relying only on anti-inflammatories if the problem continues to return. All right, and then lastly, most low back pain is mechanical. Okay. So 90+% of low back pain is mechanical in nature, and the overwhelming majority of those, all right, so 70 to 80% of those can actually change rapidly, all right, and they require movement and position strategies in order to get better. Okay, so that's the main group we're going to talk about today. Because they can get better with movement strategies, they can also often be prevented to those same strategies. All right. I should note, if you have any questions, feel free to type them into the chat. I'm going to leave a couple minutes at the end, and we'll try to get through as many of those as we can. Okay. As far as low back pain, where it can hurt obviously in the middle of your low back, across your low back, to one side of your low back. It can also hurt in in the buttock region, outside of the hip, in the groin. It can hurt all the way down your leg. It can also hurt in very specific locations in your leg. So you could have, for instance, knee pain only, and that could come from a nerve in your lower back, all right? Or you could have what feels like heel pain or foot pain, and it may come from your foot, but it could also come from your lower back. And the reason is the relationship our nerves have in our lower back with our legs, okay? Very similar to the circuitry of your house, all right? So if you're experiencing low back pain, obviously the source is often in the low back, but if you're experiencing lower limb or leg pain, you want to then find a clinician that can be kind of open-minded to the looking at what is the potential root cause, versus if we go tunnel vision on the location of the symptom only, we might miss the source. And that can sometimes lead to then chronic pain or failed interventions if you have a treatment directed at your knee or your foot, yet the problem doesn't go away. Maybe it's not coming from there. All right. So think big picture. Common causes of low back pain, often it's repetitive and prolonged positions. The things we do all the time are often in one direction, all right? Whether it be sitting with poor posture, doing yard work, which is actually the same position as sitting, all right, where our back is bent forward, all right? So that repetitive nature of movement in our low back actually is typically in only that one direction, forward, right? So we actually lose the curve in our back, which we're going to get to in a minute. The average North American forward bends between 3,000 and 5,000 times a day. All right, so that's one direction movement only. And as a result, those joints get tired of going just one way, and they often then start to fail or start to complain. All right, so why is that? Well, I'm going to try to use my pointer here. We'll see if it works. But the joint itself is made up of two vertebrae. So there's 5 vertebrae in the lower back, okay? And then one which is the top of your tailbone, all right? It's called your sacrum, all right? And then in between each of those bones is a soft tissue disc that serves as a spacer, all right? Now, the middle of that disc has a material in the center that acts like a ball bearing. And if it's centered the way it's supposed to be, then you can move in all these directions that this top picture is showing, right? You're moving around the ball bearing, forward, backward, side to side, and then you have some shock absorption, okay? The space that creates also creates a hole in the back of the joint between the two bones, all right? And in that space or that hole is out where those nerves come that go down your legs that I talked about, all right? Movement is the key to delivering nutrition to this joint. Okay, so this is a fluid-filled joint or disc. It has very little blood flow in the middle of it. And so the way it stays healthy and doesn't dehydrate is through movement. Okay, and movement's healthy. But when it gets only one direction of movement, sometimes that healthy material can change from the center position that allows all those movements we talked about to an off-centered position, all right, which you see in the bottom right here. And that off-center position will make us stiff. It'll give us feel like we can't get up from a chair real easily, or we can't bend over and touch our toes or tie our shoes real easily. And if it puts pressure against the nerve, like it's showing here, it can give us pain in our back, buttock, leg, any of those things. All right, so the key to health of this joint is maintaining a healthy position when we're putting it under stress, but then also balancing out movements for that joint. So if we're doing a lot of one thing, that we also give it a little bit of the opposite. All right. All right. A couple of things that sometimes I think this is an old study that was used, but they looked at the pressures in the lower back that occur with different positions. Okay. And when you look at, say, lying on your back, that's the lowest amount of pressure, right? Versus all the way up to, let's say, just sitting erect, which is this middle one, all right? It's actually moderate amount of pressure, which what I said earlier is same as bending forward. So if you look at bending forward, they're almost identical. So those of you who sit for work, if we're not sitting with supported posture or with a good low back position, we're essentially putting our back in a forward bent position for hours on end. That goes for you're watching a movie at night on the couch. That goes for it's not just work, right? Long trip in the car. So sitting is actually, even though it's inactive, right? It's passive. It's actually a stressor on the spine if we're not doing it with good positioning, all right? The highest amount of force, forward bending with a load in sitting. Okay, so if you're bent over lifting weights or things like that, we just got to be mindful that our back feels good before we do those types of things. This is not to mean that any of these positions are bad for us. All right, we're built to tolerate these pressures. It just, we got to make sure that our back is prepared for it. All right. So just kind of an interesting graph worth kind of noting the effects of sitting. All right. All right. So what can we start to do in order to adapt that? So I said forward bending with a load is the most pressure, right? Well, the way we can start to unload that would be, putting keeping our low back in the position of standing, all right, which would be a little bit of a lower back curve. So in our low back, there's actually supposed to be a slight, it's called the lordosis, which where it curves inward, all right? So which would be like a slight arch in your lower back, okay? That is a healthy thing, and it's a necessary position. There's a lot of advice out there where people say flatten your lower back by tightening your stomach when you lift. No, that's not. That is a way to strengthen your abs. That is a way to contract your abdominal musculature. All right. But that is not a way to protect your lower back. Okay. The way you protect your lower back is to maintain its normal curvature when you're going to lift or bend or do different tasks. So keeping a slight arch in your back when you bend down to pick up a box and move through your hips and knees and keep things like that. Okay. So maintaining that lower back position with a slight arch. That's how we were built. All right, same goes for sitting. So when we sit with that low back in a rounded position like this individual on the left here, all right, that is putting a slight stretch through the entire back of our lower back or the outside of our lower back. All right, and that starts to then cause too much pressure in one direction when we do it all the time. All right, so what we should do is have a slight arch in our lower back. All right, but unfortunately, if we sit like that without support, that's the right position, but we're going to get tired. All right, we're not going to be able to endure that for very long, especially if our attention goes to a movie or the windshield if we're driving or our computer screen. Okay, so the best way to combat that is to use low back support. All right, so many chairs have an arch in it. Many work chairs, ergonomic chairs, car seats have lumbar support. It's not whether, if we have a great chair that has lumbar support, it's not, we have to use it too. All right. So the way that you properly use that is that you make sure you push your hips to the very back of the chair. And then if you have an external like pillow support, you put it in there. Or if the chair has that curve itself, you just push your tailbone to the very back of the chair and let that chair hold your back in a slight arch. Okay. For some people, this can feel like a strain or a stressor to their back because they're not used to it. With time, you'll become more and more used to it, but it's really important that you start to adopt that position, especially if you have a history of back pain. All right. So, and I would give the same advice if I had an opportunity to go into a school setting, because it's not about age. Think about the decades worth of that same movement only starts to then cause a change in the way that joint works. Okay. So the position of our low back when we bend and lift, and the position when we blow back when we're not doing anything but sitting, equally important. Okay. Now, what about all that forward bending? Well, combating and going the other way can help. So I showed this a few months ago, maybe it was last year, but stretching in the opposite direction. So if we're always bending forward, if we could throw in a little bit of movement the other direction, we can balance out the forces through that joint and keep that joint more flexible in both directions. All right. That will help us then attain that better posture, but it also keeps the joint working well in both ways. So I'll show you a short video. So you press up, force an arch in your back as far as possible, go back down. Okay, and you could do that repetitively, say 8 to 10 times. Doing that beginning and end of each day is an extremely healthy thing to do. All right, that would prevent problems in your lower back, but also in your legs. Okay, don't feel comfortable getting on the ground? There's another option, standing. Back yourself up against a countertop or railing, something that won't break or move. All right, and bend yourself backwards. Same thing, 8 to 10 times. If you make coffee in the morning, go to the coffee maker, bend backwards a handful of times while it's brewing. Okay, that simple movement, all right, can restore balance to all the forward bending we expect of our back. Okay. All right, so quick hitting list here of if our, when with IMC, if we see a patient with back pain, or if I saw you and let's say you responded in a typical fashion, these are the most kind of the top 5 or 6 things that I would tell somebody that they need to do to lower their chance of a recurrence. All right. Well, if you can prevent a recurrence, you can prevent an occurrence in the first place. Okay. So very similar types of things. So I want to go through those. Number one is the posture correction. We all sit, even if you don't sit for work, you sit getting to work. All right. Or you sit at night watching a ball game or movies, or you sit on the ground playing with your kids or in a fishing boat, but we can't avoid it. So sitting with correct posture, every chance we can get, especially if we're going to sit for long periods. Okay. So that would include using a lumbar support like I talked about. Second is perform a lumbar motion test every day, that back bend. Okay. If you do it regularly, you're going to know what normal feels like. So that one day when you do it, if it feels like you can't go as far or you can't press up all the way, that's an indication that your back is stiff. And stiffness occurs before pain. So if you can resolve stiffness, you can prevent pain. All right. But if you don't know what to look for, it's hard to prevent. All right. So, doing a movement backwards a couple times a day, that can start to then give you a normal and something to measure yourself against. All right. And then that backward movement, twice a day is ideal. I get it's hard for us to create patterns like that if we're not used to it. All right. By twice a day, I would mean like 8 to 10 repetitions in a row, morning and nighttime. All right. Another way to do it, though, would be to just put 1 or 2 repetitions in at various times in your day. Very, very effective. All right. Highly effective. So one way to do that, interrupt sitting. Sitting at a computer in a meeting, stand up afterwards, do a couple back bends, and then move on. You've had to bend over and, get dressed, tie your shoes, get your kids ready for school, pick up weeds, whatever it is, periodically stand up, do a couple back bends. Okay. Try to create a balanced environment. That's why I put this rock balance in here. All right. So if we can balance out the forces on both sides of our back's gonna be a lot happier versus having it all on one side all the time. Okay. And the same goes with lifting. If you're going to lift weights or you're going to lift to move stuff around the house or what have you, another important time to do it. The other way to interrupt is to think about, don't link any of these activities. All right. So if you've been sitting in the car on a road trip and you're going to get out and you're going to pick up a bunch of bags and unload them, probably going to want to bend backwards a handful of times before you start lifting heavy luggage. Okay. Same goes in the inverse. If you've been out in the yard, all right, doing a bunch of yard work, bending over for a couple hours on end, or you've been exercising, so you're all warmed up and you've been doing strenuous activity, before you go sit and relax and take a load off, which you a much deserved load, make sure you do some movement the other direction. Do some press ups, do some back bends, and then watch how you sit. And you will prevent the onset of that low back stiffness. Okay, so don't link those activities together. All right, and lastly, some type of cardiovascular exercise. All right, it's been shown to not only lengthen our lifespan and reduce all sorts of comorbidities, but it's also extremely healthy for our spine. All right, whether that be a walking program or a running program or a little bit of both, those things are extremely healthy. Running does not wear out your joints. For those of you who wonder, I actually have looked at and runners retain disc height better than non-runners. Okay, so that weight-bearing exercise of walking and running is a super healthy thing for our spine. Okay, so keep those 5 or 6 tenets here in mind, and you're going to see a lower likelihood of experiencing low back pain, or you're going to recognize it sooner, and you're going to be able to then address it. Okay, so how do we address it? Knowing what normal is, number one. Okay, so you got to check it every day. And then drop down to the bottom one there. If you do experience stiffness or pain, instead of just doing the press ups or back bends 8 to 10 times in the beginning end of the day, now you want to do it, let's say 4 or 5 times throughout the day. And that should nip that stiffness right away and get you back to feeling good. And then you can back off. Okay. If for some reason it made it worse or doesn't resolve it, that's where then clinical care comes in, and you can, look into a solution like ours, and we'd be happy to walk you through a more robust assessment and figure out if you're somebody who needs a different movement, which you might. Okay. All right. But this is a great place to start. So we do have a web app, all right, that would allow you to self-test as well. All right. For those of you if you're watching this live or recorded, you can take a quick snap of that. You can make yourself an account, and it will kind of walk you through self-care. It's also a way to get a hold of us if you feel like you need an assessment from one of our clinicians. If you are one of those, we also have in-person clinics in some areas, all right, if that's part of your employer's plan. Otherwise, we have a virtual care network that we can provide care through telehealth means as well, which is actually been found to be as effective and more convenient than in-person care for people. So don't feel like that's a second-tier option. All right. Okay, well, that's all I had as far as low back pain and prevention is concerned. Nick, are there any questions in the chat that I can navigate to it if I need to?
Yeah, let me take a look. So we do have one question. The question is, what is your opinion on daily wearing of a back brace to help with low back pain?
Yeah, it's a little bit of a catch-22, as they say. It holds you in a given position, okay, which then will prevent putting your back in a position that might injure you, or if you know that you're going to be provoked by getting into certain, like say, bent over positions. But then it also prevents healthy movement. All right. So if you currently don't have back pain, it's kind of one of those that if I was seeing a patient and I knew how to take their problem away and I could teach them, I actually would advocate that they don't use it, because I don't want them to become dependent on it. I want their muscles and tissues around their back to be strong enough to tolerate different things, but teaching them how to then hold their spine and things like that. So in some cases, it's helpful, like I said, to keep you away from the aggravating factors, but then it often limits us into the directions that would be helpful, all right, and healthy for our back as well. So we've got to be a little careful to use that too much, because we become overly reliant on it.
Cool. And then the only other one is more of a comment, but just agreeing with the idea of extra support, because sometimes you're unaware of your posture, so it can definitely help out. And it's essentially agreeing with the idea of the lumbar roll and so forth.
Great. Yeah, I think there's a lot of low-cost options out there for someone who's looking for a lumbar roll. You don't need the nicest Herman Miller ergonomic chair. Matter of fact, I use just a regular standard kind of chair that has a full back to it and put a lumbar support in myself. You can get like anything from like $20 to $30 options of like lumbar pillows on Amazon. You can build your own by just folding a towel up. Or like I said earlier, if your chair, most of them have some amount of lumbar support these days, just scooting yourself to the very back of it and having that support to keep you from going into a slouch, that in and of itself is extremely helpful.
And it looks like that is it for questions.
Great. Well, thank you all for attending. Just as a plug here before we jump off, we'll have another one of these in August. I believe it's just a more general topic or across the whole body, like common injuries that one may experience. So this could be things like tennis elbow or plantar fasciitis, or you name it. We're going to try to touch a variety of them, discuss different preventative and treatment options for you. So stay tuned. Thanks, everybody.